there are a lot of your peers, such as Apollo, which are really stepping on the gas when it comes to digital. I wanted to understand what your plans are. Would you look at an omni-channel play? Would you look at e-pharmacies? Is that a route of growth?
See, our first emphasis is on improving the experience of patient as it is. So the services we offer, we don't offer pharmacy services, for instance, today. So if we were to get into that business line, that will be a new thing for us. So we are not thinking of those areas. Of course, those can be considered at a later stage, but today the focus of digital is to improve the experience, improve the efficiency, and make it better for our patients and our physicians as well.
So it's not something which is a big revenue generator, the digital piece that you're talking about.
So how I look at it is that the digital is a kind of a channel which has become very important. So that is growing. The number of patients who interface with us on a digital medium is very high. So that number is continuously growing. As high as about 35% of our patients today interact with us on a digital medium, either our app or the website or any other medium.
Okay, but you're not going to be an aggregator per se as of now.
See, we are not into that business today, but tomorrow, who knows?
Okay, the other piece, which stands out, and you did mention it earlier, is basically medical tourism. There is a big emphasis from the government as well with regards to Heal in India when it comes to medical tourism. How much is international as percentage of sales? You all have grown over 100% in the first half itself, so that's doing well. But what is the potential?
So currently it's about 10% of the revenue in terms of our overall revenue. But because our revenues have grown, pre-pandemic also it was 10%. I expect it to go higher to about 12 to 15% over the next 1.5, 2 years. The international potential is huge, and as you mentioned, Heal in India is going to bring in a kind of transparency in the interactions. And because of that, the flow of patients to organized sectors such as ourselves is going to improve. So that definitely is an area which we are looking at.
But what do you think might be the biggest challenge?
So one of the challenges is the general infrastructure in healthcare. Not necessarily the hospital infrastructure, but the social infrastructure which people need, the travel-related infrastructure, the stay for patients, other entertainment and other soft social infrastructure around the hospitals. That is one area which definitely is a challenge.
But do you think that we could probably give, countries which are as strong when it comes to medical tourism a run for their money? You know, the Turkeys of the world, the Singapores of the world.
We always will, because the cost advantage which India is offering is much higher than any other country. So that's why I don't like to call it tourism, but it is value travel. And that is happening from countries where people have economic disadvantage as well, and they don't have the infrastructure as well. So that kind of work will keep on coming. Another pattern which we are observing is that some of the countries which used to send very simple procedures and common procedures earlier are now sending more and more complex work, because they have got the basic infrastructure, they have got good diagnostic facilities. So conditions are getting picked up and they're coming in time here. So that segment would continue to grow.
You mentioned diagnostics. SRL has been an important and integral part of the business, but the PEs have been wanting to exit for quite a while now. It's been even pre-COVID. When do you think they will probably exit? Do you think that you'll maybe go for an IPO?
So we have had an arrangement where we had entered into a new agreement with the PE providers, so pre-investors, where we had agreed to a situation where by 2024 we would either go for an IPO or we would have an alternative mechanism of the acquiring these their shares. So that plan is intact. Of course, if 2024 we have to go for listing, then we have to start preparing next year. So we definitely would.
If they find an exit, will you still list?
If there is an alternative path, then obviously listing will not be.
Okay, so maybe there could be a listing for
Yes.
SRL by 2024.
Yes, because we strongly believe in that business, and we believe that it can be built, the further value can be built out of it, and that's why we are working.
But the margins are lower than peers.
Yeah, so see, this business has grown through acquisitions and over the years. We were one of the early starters. So now there are a lot of initiatives we have taken. We are increasing the presence of our contact centers, our places where we can take samples from. And at the same time, we are also working on making efficiencies and rationalizing the lab network, for instance, improving the TAT, improving the digital experience, improving the home collection piece. Those are some of the areas on which we are working.
Where do you see margins going for SRL?
See, it has become an area which is slightly competitive. And because of that, the margins are under a little bit of pressure, but we expect them to be above 20%, about in the range of about 22-23%.
But slightly competitive. Right now, you have online aggregators, you have other hospitals, you have standalone labs really clicking at your heels at this point. How difficult is the diagnostic business?
No, I look, whenever a business evolves and there are too many players come with differentiated models, there will be a little bit of pressure. But if you see already, there is some degree of rationalization which is settling especially in terms of pricing. You cannot have a model which is exclusively based on discounting. So that is changing, and because that is changing, we are seeing that the pressure is relenting. How much it is relented is for all of us to see, but definitely some of the steam of that early exuberance
the 100-rupee test.
Away. Yes.
But do you think that you are in a situation where you can eventually take some price hikes when it comes to diagnostics now?
See, we have maintained the prices. Throughout this situation, the prices have not gone down.
Okay.
So that itself, in my view, is a good thing because in any industry, the aim is to get the prices down, especially in a consumer-facing industry like diagnostics. The idea is to keep the prices where they are. But some degree of rationalization will be required. Maybe some of the tests would cost higher and some of the tests may cost lower.
You said you're comfortable in terms of debt to equity. You all are looking at some amount of expansion in terms of the hospital business. Overall, any fundraising on the cards?
So that is a little bit of constraint at the moment because of legal issues, and we don't require that much of funding. But if there was to be an attractive acquisition which comes our way, then obviously we will explore.
But that would be entirely through debt?
It could be a mix of both.
Okay, so you could look to tap the equity markets in case.
It is possible.
Okay. Say we have to, have this discussion 2 to 3 years down the line. Give us a sense in terms of where you envisage the hospital business to be and where do you expect the diagnostics business to be?
2 to 3 years, the hospitals would definitely be about 35% bigger, and probably we would certainly have an EBITDA of about 25% by that time. As far as the diagnostic business is concerned, again, we expect a growth of about 8 to 10% year on year.